Hey everybody, welcome back. We're going to launch right into the next panel, which is number 2, building innovation into the health system. To start that off, I want to introduce our moderator, Jessica Rudd, who is the National Director of New Partnerships and Solutions for Medtronic. Jessica has become a very close friend of BioAlberta over the last couple of years. She's a great source of advice and intel as we try and figure out the best practices from across the country and around the world. She has 24 years of experience in her career working in both the pharmaceutical and medical device industry. So she really is a very good moderator for this type of session. We've pulled together panelists to help with that discussion from Alberta Health Services, from Institute of Health Economics, and from Covenant Health, the Catholic provider of healthcare, acute and long-term care in the province. So with that, let me turn it over to you, Jessica.
Thank you, Rob, and ditto. We have become good friends, and it's been a really wonderful collaboration. So thank you for the invitation to moderate this exciting panel today. A little bit of housekeeping, folks. You'll see a Q&A section at the bottom of your screen. Feel free to populate that with questions. And if you see somebody's asked a question you thought of asking, you can upvote it, and they'll be batched, and we'll try and get to them during the session. So thank you. Again, I'm delighted to be here moderating the panel, delivering innovation and value in the health system. You're going to hear from 4 organizations that are making terrific strides and impact in Alberta and beyond, certainly through their networks and partnerships and collaborations across the country. We'll be hearing about pathways and programs supporting end-to-end innovation, development, testing, commercialization, and adoption. We're going to hear about lessons learned, successes, challenges, and really hope to get to, how can this impact your businesses, your organizations moving forward. And I think we'll hear a little bit about the impetus for some of this work with COVID-19 as well. Now, these organizations are making this impact and driving value in a really tricky landscape. And, a lot of us are working in this environment, so we know how difficult it is to navigate often opaque federal regulations, inconsistent provincial legislative environments, differing policies, practices, funding mechanisms, maturity of procurement. And I think we can all agree it's a challenging space to operate in. And that's why we've been called a land of pilots, but I think we're moving beyond that. But it has been tricky in our jurisdiction to scale and spread innovation, even where merits of that innovation has been demonstrated in a jurisdiction. But this work needs to be successful. Our collective Canadian pride in our universal health system is tempered when we see about how the performance of our system stacks up against our OECD peer countries. The Commonwealth Fund review is often cited that demonstrates a pretty low rank for Canada at the bottom of the table, 9th out of 11th in 2017. And you can see where we really aren't faring as well as we could. Specific to innovation, the Conference Board of Canada delivered a report in 2018, which also highlights areas for improvement, and again, ranks the Canadian healthcare system and our ability to adopt innovation not where we want to be. And that's why, again, it's going to be really wonderful to hear from these organizations and the progress that they're making. We would propose too that the supply side of innovation in Canada is actually pretty well organized, and there are many, many programs, funding sources, research collaborations, including the innovation pathways we're going to be hearing about from our panelists, which are really creating many, many opportunities. We propose that the demand side of the equation needs more focus, and this really is defined, or the policies on the demand side are defined as public measures to induce the innovation or speed the diffusion of innovation through increasing demand. Really, I think of it as matching the innovative solutions that government needs to solve big problems with the economic investments that innovators require to advance that work. I think of 3 impediments to innovation, and in varying degrees, we've overcome some of them, and particularly of late with the imperative of rallying around the pandemic response. But what's been challenging for innovators across the country are really, I think of it in three buckets: funding and reimbursement, regulation, and procurement. When I think about funding, I think about, and forgive me, Chris McCabe, I think about HTA, and where, HTA is an important mechanism, can often in Canada be duplicative. We see innovators needing to apply to multiple agencies for review and approval, and the process can often be opaque. And we still see an ill alignment to a positive review, even from a government agency, to a funding or fee code reimbursement model. So a great review doesn't necessarily mean adoption. Other jurisdictions have solved this problem. In the UK, for example, a NICE recommendation leads to an adoption of that technology by the NHS. So maybe something to think about and strive for. Funding and reimbursement can be another challenge. We think about funding silos or budgeting silos. I find surgical innovations or minimally invasive surgical innovations being a classic example, where the acquisition cost of a technology born in one budget is not factored and reflected in decision-making with the benefits downstream. So think of a TAVI, a trans aortic valve replacement, for example, more expensive technology up front. However, the benefits of a minimally invasive procedure like this to quality of life, to the risk of readmits or length of stay hospitalization rates really justifies the cost. But if the decisions are made in separate budgets or separate silos, it's very difficult. Minimally invasive and robotic surgery would be another example of where these silos and ill-aligned incentives really make adoption of innovation challenging. Regulation, another potential barrier and challenge for innovators. We've seen some good movement on this, and even pre-COVID, we saw a number of things happening, and I think about the virtual care space, some acceleration right across the country in various jurisdictions in a number of ways. Ontario was starting to really accelerate the adoption of virtual care, expanding appointments, access to data. I think of Germany as a lead in this area. They've always been at the forefront of adoption of virtual care and digital health tools. Even in 2020, enacted some interesting legislation which encouraged the adoption of medical apps and actually gave the prescribing authority to doctors and the companies with a year to demonstrate their benefit. So just an acceleration of that advancement and taking down some regulatory barriers. I couldn't talk to you folks about challenges, knowing we're going to talk about solutions, without talking about procurement. But I may surprise you by telling you that I really believe that strategic and public procurement has an absolutely pivotal role to play, and they can be a true enabler in this effort to bring innovation and value into the system. I think modern and transparent procurement processes can be adopted. There are many, many examples of established frameworks. We don't have to look much further than the Scandinavian countries who are real leaders in this area, but we've also seen some experimentation across the country in little pockets of movement towards what we call value-based procurement. Traditionally in Canada, our procurement's really been about standardization, aggregation of volume, sort of a transactional approach, and really hasn't been an impetus for bringing innovation into the system in the way it could be. Consolidation, moving to centralized procurement and big government, I think is only going to exacerbate that trend. But again, I'm really encouraged by some of the early work we're seeing in Ontario and other pockets around the country. I even think there's some good movement in Alberta. Newfoundland is actually taking the lead of codifying the term value in their procurement legislation. So we're headed in the right direction, I think, here. And the feds are on this too. We know about the economic strategy tables in 2018, and there was one specifically focused for health and bioscience to situate Canada at the global forefront of innovation. This table made a number of recommendations after really recognizing some of the challenges we've talked about: the complex regulatory environment, reimbursement, procurement challenges, the lack of the disconnection of digital health across the country, the general risk aversion in health. But they made 5 very strong recommendations, 2 of which really land on this concept of advancing this demand side of our innovation policy, including on the regulatory side by eliminating duplication and making it more agile, and employing a pan-provincial national procurement innovation agency. we've seen some good, saw some great announcements of funding that came out of this work, including 20 million early days to scale up companies in this space, and 7 million seed funding for the Can Health Network, which I know we're also going to hear more about with the panelists shortly. There was even an announcement just today from the feds for $500 million for research across the country. Now it's broadly science, but they've actually literally called out digital health and vaccine research as funding mandates and priorities. So my last note is really an encouraging word. Despite these barriers, despite what we all know can be challenging in our complex landscape, I think we can all agree that the pandemic really allowed us to accelerate some of this, some of the work to collaborate and to advance our innovation work. We saw regulatory burdens eased, funding mechanisms extended, processes streamlined and simplified, and non-traditional collaborators coming together. You may have heard that Elon Musk's SpaceX actually produced a part for a Medtronic ventilator that was in short supply. So you never know who can come together, and if we have the right procurement landscape to invite these discussions, we're going to be way ahead of the game. So I'm very pleased to turn it over to the panel to talk about how their efforts, their learnings, their spirit of collaboration, and their passion for solving problems is really advancing innovation in health in Canada and putting the health and wellness of our populations at the fore. So may I turn the discussion over to our first panelist. And I'll be very pleased to introduce Francois Bergeron. Francois is the Vice President of Partnerships with MedTech, and he has been with the organization since 2014. And his job really is to increase the impact of the consortium for its members through strategic agreements and the implementation of commercialization tools for MedTech companies, including the investment fund and the Beachhead network of clinical sites for the validation of industrial innovations. So it's great to have Francois here and talk about the fine work of MedTech Canada, and I'm going to turn it over to you, Francois, please.
Thank you, Jessica, for this kind intro. Just setting the display here. Okay, so I think you can see my slideshow. Okay, thank you. And thank you, Rob and BioAlberta, for this nice opportunity to introduce MedTech, and especially in the context of this panel. So I always like to start with this slide, restating that MedTech Plus is an industrial consortium. That's really our mandate, our goal given by first our members. It's a membership-based organization, and given by the governments who fund us. We are a not-for-profit organization funded 8 years ago in Quebec. And we also have now a federal mandate. In Quebec, we are mostly known for the grant programs that we have. We funded more than 100 projects, collaborative projects, always industry-led projects in collaboration with academic centers and university teaching hospitals. Companies usually come to us for two reasons, either to develop the technology or to validate this technology in real care settings. So we got more than 60 million total funding for these projects. And on top of that, we have close to 70 projects that are more a showcase in collaboration with the Ministry of Health, the Innovation Bureau, and INES, which could be the equivalent of CADET. So we always try to reconcile economic development, so to have a strong industrial MedTech sector, but with clinical impact for our Canadian patients. That's also part of the role. So we have 200 members, as said, mostly from industry. And you can see here a snapshot of these members. On the left square, you can see almost close to 130 logos. It's very diverse in scope and in size. You have startups, SMEs, multinationals, more and more pharma companies coming to us for the digital therapeutics. IT is big But again, it's very diverse. You have very small companies doing mobile apps, for example, to keep the patient engaged in their therapy. You have the classic medical imaging, and you have robotic surgery, for example. So it's very broad. On the right, it's the non-industrial members. So it's a lot of university teaching at hospitals. It's also other grant suppliers and incubators, accelerators, international partners, and so on. We also have a federal mandate, as said, since 2017 through the Center of Excellence for the Commercialization of Research initiative. And with that, we have two main programs. The first one is Invest. So we act as a VC. We are MedTech VC now. I will show you the portfolio. And we invest specifically at the stage where startups need to generate the evidence data. And there's a lack of MedTech VC funds in Canada at this stage. And I think we fill this gap. For every dollar we invested in companies, we got matching from or syndication from 10 times this amount from other VCs, banks, corporate venture firms. So money, of course, is important for these companies to integrate and to validate their innovation. But the other aspect, which is very relevant for the discussion today, is the MedTech beachhead that I will describe in more detail very soon. So again, the Pan-Canadian mandate, I think we are present in every province in a form or another through our investment, through our clinical sites, through our different partners. Here you see the portfolio, the investment portfolio. We have currently 20 companies in the portfolio. Some are missing here because they are closing their rounds. It's very diverse. Again, a lot of so companies from coast to coast, a lot of AI, a lot of IT. I think it's quite representative of the landscape we have in the startups in Canada. And this is to introduce the beachhead initiatives. So really in harmony with the topic today. This is how companies usually see the challenge to work with health systems and hospitals, especially startups or smaller companies. They need to know if the validation in real health settings or the generation of evidence data will last 1 month or 1 year. Will it cost 10K or 1 million? Before that, prior to that, they don't even know where to start. So there's a lot of challenges. Of course, that's totally normal. The main mission of the health system is not to host industrial innovation, it's to treat the patient. So nothing particular here, but we have to address it if we want to help these companies commercialize their innovation and help our patient access these innovations. So that's exactly the aim of the beachhead program. So the beachhead program is two things. There's a local aspect where we qualify different clinical sites, and we have 15 in the world. We have 13 currently in Canada and 2 abroad, and it's growing. So we qualify clinical sites based on their willingness to work with industry and to innovate collaboratively. And we coach them, the clinical sites and the companies, together with the collaborative projects. So the clinical site will deliver a service offer to the companies, so the companies can generate the evidence data. First, understand what evidence data they need to generate to serve their commercialization. Access to key opinion leaders, to patients, to data, to equipment, to IT people, because every solution now is IT-based, to ERBs, up to the procurement. So we put every of these key people around the table with the company around the project with the clinical sites. So to be sure that everybody is aware that this project is coming and will evolve in the clinical site and potentially up to commercialization. So we didn't want to force commercialization. If the solution is not relevant for the site, that's fine. At least we want the company to be able to generate this evidence data, what we call the sales package, that they can apply after in another market or at another site. So that's the local aspect. And there's the network aspect of the beachhead. Because if one solution is good for, let's say, the Ottawa Hospital, maybe it will be good for Alberta Health Services, maybe it will be good for the CHUM in Montreal. So we work also in parallel with these sites that show an interest for an innovation coming in the network. And we work with them to understand what level of customization will be required for this innovation to be able to potentially be deployed in the whole network. So you can see here the logos of some of these clinical sites. Most of them with logos are in Quebec, because just because we started with them the process earlier, we tested the process with them, but now we have more and more sites out of Quebec, and Alberta Health Services being one of them, and we are super happy to have you on board because it's a big part of the network. Our role on that is to give a small amount initially to start every beachhead, to start a ball rolling. Usually it helped to secure someone full-time to be the entry door for industry, to be the key contact person for us and for companies, and to develop this service offer to industry so they can generate this evidence data and a fast track or a track to adoption based on value. We bring projects and companies with these projects. So that's for the push. And we also organize call for solutions, and that's for the pool of innovation. And also, of course, we share the best practices among the network, as we are the central piece of it. So this is an example of a call for solutions. This one was launched this autumn in collaboration with the Boehringer Ingelheim company, and with the collaboration of 2 clinical sites, one in Quebec, one in Ontario, and only 2 clinical sites at the beginning. And then when the project will be more mature, it will be deployed in the entire network. So it's a call for digital solutions, not drugs. We don't do drugs. And it's in PF-ILD. It's pulmonary fibrosis interstitial lung disease. So it's a rare disease, but still it touches 30,000 Canadians every year. So it's major. And for 20% to 30% of these patients, they will evolve in a quite fast, between 3 to 5 years, in a quite deadly version of the illness. So we understood the clinical care gaps with the pharma company and the clinical sites. We diffuse these care gaps across the network, and within 2 weeks, almost 30 companies answered with potential digital solutions. And we picked some of the solutions, assembled them because they were all missing some parts, but together they are really a good solution. And this new digital platform will equip the patients at home so they monitor their vital signs, and we can see earlier the degradation of some of these at-risk patients. And at the same time, this solution, digital tool, will equip the first-line physicians to identify earlier and much better these patients at risk. So that's really the purpose of it, and it's supposed to first being done and then deployed in the network. Other examples of success stories in the beachhead, we have more than 15 companies in the network, and we all help them to generate the evidence data, to gather the evidence data, and to convince their customers in collaboration with the sites and the network. And we have 2 that are now commercial. It's Spinalogics and Shapeshift. Spinalogics, it's a company In the adolescent idiopathic scoliosis, they do a minimally invasive implant, very innovative, and it's now commercial. And Shapeshift, they do mask. So you for the COVID-19, you scan your face with your phone, and you send your this 3D model in the cloud, and you receive a mask that fits much better your face. So it's more comfortable to the people who use it every day in the hospitals, and it reduces also the leakage, so the risk of contamination. So I think it's good, very good things for the network. And I don't mention the others, but there's plenty of good stories in the network. So in a nutshell, that's what we do, and in answer or to illustrate the role we can play in integrating innovation into the health systems. Thank you for your attention, and we'll be glad to answer your questions later.
Thank you, Francois. That was really great, really interesting. I know I already have a couple of questions, so we'll see what comes up, and maybe my question will get voted up too. So that was fascinating. And we know you're working closely with AHS already. That's great as part of your Beachhead network. And so it's perfect to turn it over to Marc Leduc, whose team you're working closely with. I think everybody in the audience must know Marc as I do. He's a good friend, and really plays such a pivotal role in the AHS organization, driving innovation and research. His official title is Senior Provincial Director, Health Evidence and Innovation for Alberta Health Services. And Marc leads a very large team focused on enabling AHS staff, clinicians, and researchers to create, discover, share, and apply knowledge to achieve service excellence and improve health outcomes. There are great partnerships with academia, many clinical trials and research studies happening now under Marc's leadership. The strategic clinical networks are a critical partner for Marc's team, and important that these groups are coming together to identify these challenges, assess the value of emerging technology and models of care, and solve the priorities in AHS. And the most important thing, I think, for the audience is Marc is also key in overseeing the partnerships with Alberta Innovates, and particularly the PRIUS program, as well as the HIS program with Alberta Health. So these funding mechanisms and pathways. So Marc, over to you to tell us all about the good things that are happening with your team in Alberta Health Services.
Well, thanks, Jessica. It's great to be here with everyone today. Jessica did a fantastic job outlining some of the major structural issues that I think health systems, certainly in Canada, face. So thank you, Jessica, for doing so. I'm bookended by Francois, who just spoke around MedTech, and I'm going to touch on how we're approaching that partnership with them in Alberta. And then Dr. Chris McCabe will kind of wrap things up and speak, I think, at a more granular level around how we will talk about the measurement of value. But I want to focus in on that next layer of granularity and paint a bit of a picture for you, and also look at where we're wanting to work with our ecosystem partners to support or address a number of the issues that Jessica alluded to in her opening remarks. So in Alberta Health Services, let me just make sure I've got the right lens. Okay, so in Alberta Health Services, here's a quick snapshot or directional statement from our upcoming health plan that is still to be finalized. So this is a draft, but so it might tweak a little bit, but generally speaking, these are the broad directions that we're wanting to focus in on over the next decade. So in making sure Albertans are full partners around their care, continuing with the shift from acute care focused or hospital-based delivery to community and home-based models of care, integrating primary care with specialty care, continuing care, and other sectors of the health system will continue to be a primary focus for the organization and our health system more broadly, as well as trying to better meet the needs of Albertans with addiction and mental health concerns. Underlying all of that, though, is the ability to leverage our technology and the innovations that entrepreneurs, clinicians, and others are bringing forward primarily to the market is how I'm going to frame it. If we can't buy it, then it's going to be really challenging for us to do anything with it. But ultimately, that cross-cuts all of these 4 directional areas that we want to focus on over the next 10 years. And is really going to be critical for how we improve health system performance overall, and more importantly, achieve better clinical outcomes for individual Albertans. So when we talk about innovation at Alberta Health Services, so in our strategy from a few years ago, we took a high-level definition, which is really around new and improved ways of doing valued things. So things of value, that is a word that's going to come up a lot and means a lot of different things. In healthcare, often the stereotype is that we deal with the change around trying to be 100% certain about before we do anything, right? So this advert from the Netherlands kind of speaks to that culture of do no harm. And in order to be able to do that in the context of healthcare, we need to be 100% certain, even over certain, right? Or before we do anything in going forward. There's a number of issues that comes into why, as Jessica outlined in one of her slides, when there's a recommendation for adoption or for use in changing the standard, the model of standard of care, why that doesn't necessarily translate into adoption. This slide speaks to some of those particular issues. I won't belabor these necessarily today, but we are working on a number of these different elements. The key that I wanted to emphasize a little bit is around healthcare is a team sport, so there's a lot of dependencies between multiple players, and so making changes in that environment is complex. As well, ultimately, all innovation adoption is about people and their workflows and behaviors. So at the end of the day, a lot of the technical pieces are really about helping our individuals make some of the best decisions that they can when it comes to where we invest our time and money in order to improve the outcomes that we are achieving. We have been investing in our innovation infrastructure. Jessica mentioned the strategic clinical networks, and that is an underlying platform of multiple communities focused around various patient needs. So seniors health, for instance, would be one that cross-cuts and tries to follow the patient from the time they're, or even before they become ill, right through to potentially up to end-of-life care. So depending on what their needs, but follow the patient journey, and then how does the system respond? And so we've been working on organizing the different stages of evidence that's needed to support the decision-making in terms of adoption. And we've taken this innovation to action life cycle, and we've moved to the next layer of granularity in what we call the innovation pipeline. And we'll be releasing more details on the pipeline soon. Our focus is going to be around moving from identified performance gaps. There seems to be a timer on my slides here. Performance gaps that can then be moved to ideas, proof of concepts, implementation, and then adoption within Alberta. So when we look at the components of evidence that we need to demonstrate value, we've been embedding, so we're trying to ensure that we don't over-design or over-engineer this at the front end, and we can allow people to experiment, to test, to develop prototypes, look at what the value might be. But what we do want them to be able to do is make sure they touch the different quadrants related to sustainability and improving health outcomes and or patient experiences, provider experiences, maximizing the health outcomes for the money, so the economic, and really how we actually spend our money in the health system. And I do describe it as the health system because AHS certainly doesn't have full oversight of all aspects of the health system. We work closely with Alberta Health and the Ministry of Health and others around this, but how do we generate value and where do those benefits materialize? And then looking at, can we actually implement this? So there are switching costs when it comes to changing current practice, changing workflows, embedding these, if it's a digital health opportunities, embedding this into the clinical information system, the back-end IT systems, And how do we deal with the issues that our IT colleagues do worry about legitimately when it comes to some of the darker scenarios that they think about? They have happened even here in Alberta. In other parts of the public health system, or not the health system, but the public sector, there have been real challenges in terms of some of the concerns being realized. We've also seen the National Health System in the UK deal with ransomware and other issues. So a lot of these concerns are real. And so looking at how do we implement this and change behaviors at scale is always going to be an issue. And then we're always after the equity issues. Are we leaving people behind when we look at new innovations? We also then have mapped this against the quadruple aim. So improving patient and family experiences, improving patient and population health outcomes, improving the experience and safety of our staff, our clinicians and frontline people that work and provide the care, and then improving the financial health and value for money of particular innovations. These get layered in at different stages of development through as you take an idea from a proof of concept through to it's now in the market and can be procured at scale. So the evidence base will increase, and the kinds of things we're looking for, Dr. McCabe will speak to, the kinds of questions that will be that we've embedded into the 6 dimensions of quality that as we move through the quadruple aims and the 4 main quadrants of value that we're looking for. There's a lot of work that we still need to do. AHS cannot do this alone. We rely on our ecosystem partners to help deal with risks and issues that are just not in our core competency, right? So there are things AHS that are our core competency that we are good at, and that we need to be at the table to help address. So, patient safety, clinical effectiveness, for instance. Can we provide feedback to entrepreneurs with their prototypes to help them look at improving their products or getting the data they need to meet the requirements for regulatory approvals, for instance. On the other hand, there are business side risks, investment risks. Francois spoke to the venture capital component of MedTech. We have very little offer around that. That's not our core business. So we rely a lot on our ecosystem partners to help deal with other types of risks that really are not our core business to try to address. So, and the opportunity ahead then is working with our partners across the country and in Alberta around this. On this slide, I wanted to kind of highlight the adoption curve as well as the valley of death. So these are fairly traditional for those of you who have looked at, I guess, the literature related to the innovation lifecycle. My point, I guess, around this is that the adoption curve does vary from individual to individual. So for instance, I'm a laggard when it comes to wearable health devices. I do not own an Apple Watch or a Fitbit, but I'm an early adopter. I was an early adopter for the Netflix DVD platform when it came to Canada back in the late 90s, early 2000s, right? So this will vary, and where I sit on the curve on a particular device or a particular innovation really frames my thinking about it, right? So if I'm a late majority, I have a different risk profile or a different value proposition than an early adopter would have around a particular solution. So when we engage with our clinicians, this varies for them as well when it comes to new opportunities that are coming our way. And so we are wanting to work with you and others on how to address this and help frame what the value might be. I think Francois talked about inertia, right? So there is inertia in terms of maintaining the status quo. That's tied to some of the factors Jessica alluded to in terms of how funding flows in the system, where the benefits and the risks show up. There could be a great opportunity that improves or reduces, say, length of stay. And so we can offer additional acute care to more people. On the other hand, if the basket of services for lab diagnostic imaging and other support services remain the same for those patients, then their costs will increase while we get more value or more opportunities to use our beds, for instance, in the acute care world, because of an improvement in care that we've been able to implement. In 2018, we had a meeting with MedTech partners. So this is MedTech Canada, it used to be called MEDEC Canada. It's a great event. I've always appreciated the opportunity to work with MEDEC. or MedTech Canada. And, I had the opportunity to ask the membership, there was 45 people that responded, about when they think about working with health systems, what are the kinds of factors that are useful? Speed was the big one, you can see, and that is really challenging for us, in part because we don't have dedicated resources to work with entrepreneurs and industry partners around their specific innovations. Our focus have been more around what are our priorities, and can we either co-design innovation if there's nothing on the market that will address it. And that's really part of the opportunity, is focusing on what our needs are. What's happened more recently then between the funding from the Government of Canada for the CanHealth Network, as well as for the MedTech Beachhead concepts. And now I'm pleased to announce that AHS was recently awarded funding from Alberta Innovates in their Health Innovation Platform competition that they just announced. And all three of these funding sources are, while they have unique attributes and deliverables, they complement each other very, very well. So we're able to then leverage that external funding to provide dedicated supports. And we're focusing for MedTech, for instance, in terms of our first beachhead prototype, on a stroke and neuroinformatics team that will be able to work with industry partners and others around those kinds of innovations, and hopefully get better at evaluating those and making recommendations, both to the entrepreneurs who are bringing forward those innovations, as well as to the clinical teams that are involved, who are potentially interested in bringing those in. In the interest of time, I'll skip the Ventilator Collaborative, but that was a piece of work that we did this summer with a number of different partners who stepped forward really in the midst of the pandemic crisis to try to improve the types of ventilators that might be available in urgent situations if the pandemic got worse than happened last summer. As it turned out, some of those ventilators were used in the most recent wave this fall and winter. Again, to me, I guess what I wanted to speak to is that we have now secured some external funding that will allow us to work with our partners to address some of the issues that Jessica alluded to, that others will allude to, around how do we pull these opportunities in. There's a lot of things we don't know. So the fact that entrepreneurs are coming forward, or clinicians are coming forward with new and novel solutions, it does mean that we have to get better at understanding what those opportunities look like, and assessing value with the right level of evidence at the right stage of development. So we don't want to snuff an idea with an evidence bar that's so high that nobody can really meet it. There's not enough resources in the world to do it. On the other hand, as they advance, the bar does rise, right? So if we're going to adopt that scale across the entire province, for instance, and make it available to Albertans in other communities outside of the demonstration context, we want to know what the switching costs will look like, what the feasibility will be to implement that, and how do we capture those gains that are being promised by the proponents. So I'll stop there, Jessica.
Thanks, Mark. Thank you, Mark. I've had the pleasure of working with your team through some of these programs, and there's just some tremendous thought that's gone behind this, great relationships that exist. And I think that your team is very good at helping navigate the ecosystem to understand where the priorities are, how to enter into the process, where the funding sources may be, and where the criteria are. So I'm sure we're going to have more questions about that from the audience. So thank you very much, Mark. We're going to turn it over now to Connie Avila from Covenant Health. So a sister organization to AHS, and we're really pleased to have Connie join us today because there's a lot of new work coming out of Covenant Health now around an innovation strategy, and Connie leads this strategic vision for Covenant Health. Her role really is to empower her team to move beyond the status quo and look for unique and innovative opportunities, and as a critical partner to AHS and to drive health and innovation in Alberta. Connie has a unique background, having worked for AHS, the government of Alberta, and in private sector. So it's a really good mix of experience and insights that she brings, a unique perspective to the Covenant Health team. So we're really excited to have you here, Connie, today to talk about what's happening at Covenant Health. Thank you.
Thank you so much for the kind introduction, Jessica. And also thank you so much to Rob and the team for having me today. What an honor to present and follow Mark there, who's basically on a race car there when it comes to an innovation pathways where we're still learning to walk. So I'm excited to present a little bit the ideas and where we're heading with innovation. But just to step back for a little bit and give you guys a little bit of a context in terms of who we are and how do we fit in. Covenant really is a key strategic partner in Alberta's single integrated healthcare system. So our goal is to support government and AHS to contribute essentially to a sustainable health system. And the Covenant family really contributes to the health and well-being of Albertans through 3 non-for-profit Catholic health organizations that are made out of Covenant Health, Covenant Care, and Covenant Living. So 3 organizations that share one vision and the same values and providing acute continuing care independent living services at 26 sites within 15 communities all over the province. So quite a large significant footprint, especially also when it comes to continuing care with over 2,300 beds within the province. So as you can see, why are we organizing ourselves for innovation? We are large enough to make a significant impact, but also still nimble enough to make things happen quite easily when it comes to innovation. By utilizing our strong service orientation and the impacts and benefits to developing a strategy are really to enhance the system transformation through our strategic contribution. So we're strategic partners to government and AHS. And with that, we want to showcase our value add and contribute leadership in Alberta's innovation ecosystem as a trusted partner. And that we want to do through accelerated adoption of innovative models and practices, as well as support the stimulation of the economy through technology partners. Also shifting the system from overall intervention and institutional care to more a community-based approach. So which will help us also at Covenant to further our existing culture of innovation that we already have and build a healthy and measurable ecosystem, improve the quality of service, lower the cost, and predict and prevent healthcare through our insights and leadership. So how do we fit in the system in terms of what is our role in an integrated system together hand in hand with AHS in there? We roll up to government through AHS as a strategic stakeholder, and we're part of a strategic alliance working collaboratively to deliver quality acute care and community services and ensure it is integrated and seamless from a perspective of the patients, the clients, and the families. We operate within a shared services agreement, sharing our support and systems and processes with AHS, and alongside with AHS, we're a service provider acting as an independent provider to ensure quality of service. So moving over into the innovation space here, in terms of innovation, when we first started just about a year ago to put our thinking caps on, and our board of directors really has challenged us to think outside the box and think how can we play a bigger role in helping AHS and government transform essentially. That's when we kind of just did a quick snapshot of a gap analysis and looked at where we're at and realized that we're really good at providing services and the quality of services we provide, and that is really happening at the point of care. And often government asks us for our advice and our leadership in terms of moving the needle and challenging the system a bit. So we have dabbled around in the world of the kind of the system transformation side of things. But then where we really want to put an intentional focus on and build that capacity is on the disruptive side of things. This is kind of where we haven't really played a role at right now. And looking at the different components of innovation in terms of what is required to develop a bit of a pathway that way, really is through the partnership and the resources, the processes and the structure that is there. But then most importantly is working with the people and furthering the culture of existing innovation that we have. So making sure our strategy is clear and we know the direction that we're heading in. So with that, we really developed an innovation framework at Covenant, and essentially what that is to meet our 2 main goals. So first of all is a kind of the internal focus on enhancing our organizational culture and leadership and the processes to drive and support the innovation, And then with the external approaches, whether it's through traditional or non-traditional partnerships, but really establishing the priorities, helping advocate for system transformation, and then helping out our funders and which is AHS and government essentially on that. So in the middle part, you kind of see is really the focus on taking intentional approach on bringing in the capacity for innovation and making space and working with our operations and our leaders and all together, then to really tackle that, making that room and focusing on the culture of innovation, to then also think a little bit outside the box and how can we really bring in a kind of generate revenue and bring in other funding sources to help us not to always go to government and ask for another funding, but how can we think outside the box on making things happen? So Mark kind of alluded on that kind of the venture capital area. And this is something we thought at first that would be kind of the last on our priority. But when we started to just organize ourselves and hang up the shingle essentially a little bit, the uptake was enormous. So the organizations, they're ready to work with break through the kind of like what he mentioned, the death valley within healthcare. And the beauty of working with venture capital, and we've started to engage a bit in there, is really that the venture capital will help us bring in the business acumen and bring in the funding, while we really offer ourselves up as a bit of a petri dish of a platform for innovation, where companies can try out different ideas to then essentially become a primary commercialization partner. And the cool thing about moving then into the early adoption lens, when you look into different streams of innovation, is really that if it works and we are able to try something, then likelihood could be that the greater system would see the value and also adapt that. Then what we did is really synthesize the information kind of as we're playing a role already on the systems transformation and showcasing our leadership and always being a partner and strategic advisor to government and others. And what is the current capacity that we have within Covenant already? So we're really focusing on the vulnerable population, whether it's within palliative care, rural health service, mental health and addiction, and as well as seniors care. I just touched on the kind of the venture capital side of things, but moving over into the palliative care area. So we have just been provided funding from government, $5 million in terms of palliative care for our palliative institute to increase end-of-life services, promote advanced care planning and public awareness. So as you can see, we showcase our great leadership and position ourselves beautifully where we can really try out different things and play a more innovative role. But looking ahead on where we want to get started in terms of developing an innovation pathway and bringing in the capacity, coming out through COVID and kind of hitting the third wave right now, it has become really clear that thinking in terms of our broader innovation strategy, that we need to start as a first step focusing around the seniors, especially in terms of the large footprint that we have within the province already. And just started engaging in a bunch of conversations. So it has become really evident on how underserved the sector is as a whole. So this is why we have developed a solid vision there, especially as Canada's seniors population is expected to grow. The pandemic has shown a light on the many important issues related to aging, including safety, independence, quality of care, human connection, and the meaning of well-being. So really, taking on that holistic approach and working with partners. And we have been asked to contribute and participate for a call for a major shift from reliance of high-cost medical-focused models on crisis and intervention and focus more on the community aspect, the development of new thinking and support the quality of life, the choice, the independence, and that through technology. So taking on those innovative approaches to meeting the whole person needs of those that we serve, and in terms of safety and social connection and mental and emotional well-being. That is really beyond the walls just of a hospital, but also thinking ahead on what are the needs of the seniors. The seniors of today may have different needs and wishes and wants than the seniors of tomorrow. So really taking on that holistic approach and focusing on the greater vision on that. So we have started on two major initiatives on that, just to highlight them really briefly. One, we call it our Courage Project, and that is really in collaboration with St. Elizabeth's Health in Toronto. They're a strong partner within the Catholic network of ours, in the national network, and we have started engaging in a national conversation around action for better aging. So this is just in the early exploration stages, but really looking at the opportunity on making a bit of a movement on, instead of just listing kind of what is wrong, but what are the different areas that we see are ready for to be improved, and having a national conversation around, and then inviting other partners to contribute to that and all their knowledge and challenge the policies and the decision making around that. And besides that, we also started on an initiative around the transforming aging in Alberta through technology innovation. So that is really starting with its senior in terms of an innovation pathways. And we're in the really early conversation stages, but looking at exploration of partnerships, such as with players like Alberta Innovates and WD, having had those early conversation and leveraging each other's strengths, which is for us really the care delivery, having a solid vision on where we want to head towards aging in place, but then also bringing in partners that are more traditional and non-traditional in terms of supporting with technology on contributing to the greater vision. And then also in Covenant, on what we're all about is really partnering with seniors and families in terms of our goal is to really grow strong communities, to foster social and physical well-being, and that's through partnerships and collaboration involving health, technology, business sectors. Essentially what we want to do is enable innovation companies to break through the health market and boost the Alberta economy, and then support the fiscal sustainability through stimulating the economic growth and foster really the community renewal and resilience. So why is Covenant well positioned to do so? We have a very, very strong and crisp vision. We will be leaders and partners in acting as catalysts for transformation in order to meet the needs of those we serve. But we also have a 150-year-long legacy of service and always showcased our leadership, making more out of less and really rolling up our sleeves and pitching in. And we have a strong national and international network, not only through our faith-based partners, but through many of the community partners that we work with, as well as a really large provincial impact. So in a nutshell, we're ready to provide a platform for innovation, hang up the shingle, and play a big role in contributing and in helping HS and government in succeeding fulfilling the goals there. So with that, really looking forward for Dr. McCabe to bring this home, and thank you for listening and having providing me the opportunity to present.
Thank you, Connie. Exciting times at Covenant Health, in great hands under your leadership. So thank you very much. We're really looking forward to seeing how this is going to translate into some new partnerships, and your focus on seniors, obviously very timely at this point. And I think your nimble organization is going to be able to make a major impact in short order. So congratulations and good luck with your fine work there. Okay, over to Chris McCabe. Dr. McCabe, thank you for agreeing to pull up the rear in this discussion. And I know your perspective is going to be a little bit different. So for those of you that don't know Chris, though I'm sure most do, he's been the CEO of IHE now. I think it's 5 years, Chris, or is it? Time flies. You're on mute.
Only 4. It just seems
4. Okay. Well, we stole you away from the UK, where you were working under full professorships at the University of Sheffield, Warwick, and Leeds. I assume not at the same time. And you came to Alberta. You're a professor of health economics at the University of Alberta and hold the chair for Capital Health Endowed Research. You've got a lot of hats, actually, Chris, in addition to being the CEO of IHE, with work with CADTH. I'm authoring the 4th edition of the CADTH Guidelines of the Economic Evaluation of Health Technologies in 2017, also advising PMRPB, PRB, sorry, and issues related to the regulations of setting prices for drugs in Canada. Currently the chair of the Royal Society of Canada, the COVID Task Force Working Group on the Economy. Geez, so we're really lucky to have you, Chris, today with all the things you've got on your plate. So thank you very much. And a unique perspective about what IHE is doing to support SME in the commercialization platform. And we're really excited to hear what you can share with us today. So over to you, Chris.
Thanks a lot, Jessica, and thanks to Rob and the BioAlberta team for the invitation to talk today. It's quite a thing to be following on my fellow panelists. Those were great presentations, and I hope I don't disappoint in the material that I provide. I know Mark was looking forward, maybe might not say everything that he hoped that I'd say, so I apologize in advance for that, Mark. But it's really great to get this opportunity to come and talk to the BioAlberta community. I think you're so essential to our province's future, not just in health and healthcare, but for our economic diversification. We know these are challenging times, and you folks are a really important constituency for helping us all navigate through these trying times. So it really was great to be invited, and I hope what I say is useful to you all. So for those of you who don't know much about IHE and even less about myself, I'll just take a couple of minutes to explain that IHE is a not-for-profit that's been around for 25 years now. We were established in 1995, and we're really quite rare in that we were created by the Government of Alberta, the Universities of Alberta and Calgary, and the Canadian pharmaceutical industry. From the get-go, we were a tripartite research, government, commercial, private sector entity, and it is in our DNA that the solutions are found in collaboration. One of our major roles historically has been to be the non-drug HTA agency for the Government of Alberta. So we provide HTA reports to the Government of Alberta to help inform their decisions about what technologies they will recommend to Alberta Health Services. And we continue to do that work, and it's very important. But in 2017, when I came and took over the role of the Chief Executive, I wanted us to reinvigorate our relationship with the private sector and to start working closely, especially with SMEs in Alberta, to help them navigate the changing environment in terms of what it takes to get from having a good technical commodity to having a commodity that people like Mark are able to recommend to their board to adopt into the system. And it's a real change in culture and a different paradigm for how we think about technologies, how we think about evidence. And SMEs, it's hard. You know, you're busy developing your technology, doing your core business, and the rules of the game were changing all around you. And it seemed to me that we, as a not-for-profit, but with a strong interest in the private sector, were really well positioned to help you as an SME community navigate this changing world. And so we were fortunate, and we got an investment from the Government of Alberta of about $1 million to start developing a program of work to support SMEs. And the first 3 years, we just wrapped up a report to the government saying thank you very much. And the return on investment in terms of inward investment to the companies that we worked with, for that $1 million, they got over $21 million worth of investment. So it's really gratifying to have been able to see that return on investment from helping SMEs understand their changing environment. And really, I'm going to talk to you today about the system that we have developed using that initial funding from the Government of Alberta, and how we've been fortunate enough to get longer term funding from a number of different backers, financiers, federal government, as well as provincial government. Okay, so talking about value-based healthcare, When I first got into this, the triple aim was the thing. And it seems pretty straightforward. You know, as an SME, you could look at that and say, okay, so it's about how I contribute to population health, how my technology improves the experience of care, and what does it do to the cost of care. That's not very complicated to get your head around. And it's kind of the things that SMEs were thinking about anyway. And just as we all thought we had that nailed down and we knew the rules of the game, what was meant by value exploded. So we had the quadruple aim, which AHS adopted as really important. I'm tremendously supportive of it. I think it's a great development, but it makes what companies need to be able to say about their product that much more complicated. You know, adding to the usual things, we're interested now in the clinician experience. You know, can a technology help and mitigate the pressures on clinician burnout? So that all seems sensible. It's a manageable expansion. And then it all exploded. We started getting ideas of a life cycle technology assessment where we had to be constantly thinking about how we are generating evidence to inform the next stage of technology's development and a technology's adoption, and how the adoption would generate evidence that would then inform the update of the technology. And you've got this wonderfully virtuous circle. But as a burden on SMEs and as an environment, a landscape where they're thinking about, well, what do I need to know? What do I need to be able to say about my product? So very, very challenging. Okay, and needing a lot of resources and a lot of different expertise your typical SME won't have. You know, you don't have the resources to put this together. You know, I've heard, you know, pharmaceutical MNEs and med tech companies complain about the resources they have to put into to actually have this capacity. So that gets more complicated, and then we get the learning health system, and we're bringing the patients quite appropriately in their family into the evidence of their experience of technologies and what they call value. And we start talking about co-production of knowledge and co-production of value. And we're talking about how can we use our real world data assets to support on-market, in-system evaluation. So again, it's getting a lot more complex. You have to know what data assets exist in a health system in order to be able to take advantage of them. And you have to know how to navigate the system. And Mark's team have done a fantastic job of supporting us, us fellow stakeholders, to know how to talk to the right people, to understand and navigate our way through the system. But it is a hugely complex system. And again, from an SME sitting on the outside, tremendously challenging. Who to go and talk to, how to make that work. And as I say, Mark's team has been putting a huge amount of work and effort and making great progress in reducing that challenge and getting it to a manageable level. And then just to, you know, as we thought we had a hold of that, we got the value-based learning system, where we're trying to capture the patient's experience, the consideration of population health, the provider experience, and we're trying to align it with some core values. Just a tremendously complex set of things that an SME is meant to be able to speak to. You know, this is my day job. And sometimes I go, yeah, how do I keep all these plates spinning? How do I keep on top of everything? And really what we've put in place is a program where SMEs can access experts who can help them identify what evidence they need to have in place to be able to meet the needs and the expectations of different actors in the healthcare system. And it's not that those expectations are unreasonable or inappropriate, it's just that for an SME to have that expertise as well as the expertise to develop their technology, it's a big ask. And so we've created our industry partnerships platform to make sure that the economic, the value case that an SME is increasingly required is available and can be made available for them by experts. And after our initial funding from the Alberta government, the Ministry of Jobs, Economy and Innovation, we've now got Western diversification, economic diversification funding for the next 2.5 years. We've got funding from the National Research Council, IRAP, Industrial Research Assistance Programme, and just yesterday signed a contract for new funding from Alberta Innovates. So what that enables us to do is to support companies on a matched funding basis, because you know, the SMEs, your budgets are tight and your demands on your resources are limited. So, well, are large compared to the resources you've got. So we know it's important that you have skin in the game. So you do have to put some money up front, but we also have match funding from different levels of government to help you access our services. And what do we do? Well, we've got a range of services. The first one, as I say, this is when we're focusing upon an early stage technology. So this is not one that's ready to go and give a dossier of information to Mark. It's, you know, you've got your prototype, you know how you think it's going to work. And the question is it worth making the investment, the substantial investment of time and money to take this through the commercialization process? Is there enough headroom? So is the combined effect of your technology expected impact on health for the patients and resource expenditure for the health system and other social impacts, equity impacts maybe, is that going to be big enough to support the price that you're going to need to charge to make a return, you know, a commercial return on the investment? Because if it's not, it's better to stop now and look for another application of your technology that's going to be able to have the headroom to make a good commercial investment. And then we move on, assuming that's positive, we move on to the payer value assessment. So we're looking to say, okay, what's the price going to be? You know, what's the maximum price that you could support with this technology? Because once you've got that, then you know what your prices are. You can look at markets and decide, well, will this be attractive to different payers? Because Alberta is an important market, but we all know you want to scale across North America and into Europe. So we want to look across major markets for you. And then with that information, the third step is to look at the return on investment, you know, because that's what the investors want to know. So we'll go through that. I'm not going to, in the interest of time, I'm going to flick through these next couple where you're looking at headroom in terms of health headroom and cost headroom, as I've already said, and the maximum price. And you can see how as the probability of getting funded, getting market access reduces as your price goes up, and we can actually attach quantitative probabilities to that for you and identify the sweet spot price for you. And then we have the second area, which is where we're working with market-ready technologies. And we work closely with Mark's team in understanding what AHS is looking for to put together an evidence base, an evidence dossier that will meet their expectations to help you as an SME understand what evidence you require to meet the expectations and therefore have a good probability of adoption. So we have what we call our SME support pipeline. And it starts with, if you are an organization with multiple technologies or multiple potential applications of your technology, a multifactorial triage to say which ones are the best applications, which have the best opportunity, the best chance of success. Where should we focus our limited resources to give us a good chance of success? Those that have a good chance of success on that triage are then taken into the early technology evaluation, that headroom analysis. One of the things that we can come out of that actually is the third phase, which is an evidence development plan, which says, this is the evidence you have now, but this is the evidence you will need to have for adoption by health systems. And we design a bespoke evidence development plan, which you can then, as a company, then go and implement, and will help you connect with key clinicians and health systems who may be interested in being trial locations for that. And once that evidence has been collected, then we can update that evaluation. And so we go from supporting technology prioritization through supporting capital raise and health system engagement through research development and onto here is a robust submission, evidence submission dossier to get you adoption by the health system. And that's what we try to do. So thank you for listening.
Thanks, Chris. That was fantastic. I think I'm certainly clearer on where an SME, depending on where they are in the stage of evidence collection or commercialization, they can come to you. And maybe in a future presentation, we can sort of see where IHE starts and where Connie's team or Mark's team comes in along this whole pathway and really get a good handle on the ecosystem. Then, of course, where Francois' network can really benefit the whole innovation story. So there's a lot of interconnectivity here. It's confusing, but there's opportunity, and I think we all have to be courageous and jump in and reach out and dig around in the system. So that's fantastic. So thank you all. We've had a few questions come in, so if you're ready to be put on the spot, I'm ready to do that. And actually, the first question is very tough, so I'm going to see who's going to be bold and answer it. But it's timely. So, and none of us are experts about this, but it was a question that came from the audience, specific to Alberta, specific to the recent release of the budget on Monday, the 2021 budget. And a question from the audience about maybe the perception of the panelists about how the province is investing in life sciences. We did see a lot of funding announcements, and there were some pretty detailed dollars going against priorities. But what's your sense about the commitment of this government to investing in life sciences broadly? And so this is sort of a perception question, but welcome the discussion. Anybody want to jump in first?
Well, Jessica, it's Mark. I mean, I don't envy our government or any government really these days at all levels, municipal right through the federal. But I do appreciate what Premier Kenney and the government of Alberta are trying to do in terms of balancing investments of public taxpayer funding, right, to support our life sciences sector. We have tremendous talent in the province. Chris spoke to certainly what IHE brings, but there are a number of other incubators, accelerators, and other centers of expertise. I didn't even touch on several that we get to work with on a regular basis, like the Word 21st Century, the Grit Hub at the Glenrose. There's many others that offer that kind of niche expertise to support digital health. And then more broadly around the whole life sciences. I think COVID has been a wake-up call for all governments in Canada around our supply chain vulnerabilities and what we might need to look at strategically in terms of local capacity to respond. And I think the government of Alberta has taken that lesson to heart and is looking at ways to look at the Alberta situation. And then I would just acknowledge the federal funding that MedTech has received, CanHealth has received through, so for the CanHealth West network was Western Diversification out of Saskatchewan was the funding body, but it's got BC, Alberta, Manitoba, and Saskatchewan all as part of that network. It allows us to divide and conquer and to build on our local expertise. So if Alberta puts out a shingle around neuroimaging and saying, we want to get even better because we are leading the country around outcomes in the space. If we can get better there, we can take those opportunities and do those. But if there's one that's really going to be challenging for us to accommodate, can we refer them to CHUM in Montreal, for instance, if they're the expert, or the Ottawa Hospital as the part of the MedTech Consortium? So how do we support our local entrepreneurs to find that center of expertise and bring, get the feedback that they need in order to, if they're pre-commercial, to finish that complicated journey, and if they've entered the market, then how to break the Canadian market. And I would say our world is a little bit different than the rest of the world, but obviously sales in Canada is seen as a launching pad to be able to attract sales elsewhere. So even though our market is reasonably small globally.
Benoit, did you want to weigh in on the notion of how the network can operate when priorities are different in different jurisdictions?
I can, if you want, Jessica. Thank you. And yeah, so Canada is, we repeat that, it's a small market, but we have to see our strength also. And I think Mark put the table for that. There's a strong toolbox for innovation. R&D is covered on many aspects, IRAP, SHRED, grants, and really our entrepreneurs have to take advantage of this. And then after, and what we do, what Mark does, what everybody's in this panel does actually is to help these SMEs or Canadian innovators go to the next level, because we are good for R&D, we are good for innovation, we are good for patenting, we are good for publishing. Now we must be good for commercialization. Even if the market is small, it's a fantastic place to experiment and to validate and to generate this sales package that will be applied elsewhere. So we have to also see the bright aspect of the thing, and it's a safer place to experiment for many SMEs. Now, it's not perfect, but having these Canadian networks helps to identify the strength and opportunities of every province brings, or every site brings. And by playing the network, we can, I think, together give these best opportunities to every companies we see collectively, and it will work, I think, if we work together.
Thanks, Francois. Chris, when you think about your the matching funds and the support that you have from the ministry and other Western diversification, and now Alberta Innovates, congratulations on bringing them to the table. You know, does the budget impact what was handed down on Monday? Does that encourage you that there's going to be investment and you're going to, you know, be able to continue to do your fine work? Are you concerned about that?
I think I'm encouraged. When money is tight, demonstrating value becomes all that much more important. And so actually we can help Alberta SMEs be winners in this more constrained environment. It's not just Alberta that's in a constrained environment. We're going to see that story across the country and in other countries as well. And so I'm encouraged that we can be part of the response to the challenge. So I'm very upbeat. I think this government, like many others, when you make the value case, will be willing to invest, because they know that's where economic growth for the future is going to come from. So I'm pretty upbeat.
Innovation is not a line item. Innovation solves problems. Yeah, that's great, Chris. Connie, I wondered, and one of the questions coming from the group is, you know, how do you articulate the priorities that Covenant Health is interested in exploring? So you're offering up your organization to be a petri dish for innovation, and I know this is something that Mark has contended with, this push-pull, and Francois mentioned too. You know, I think that people want to bring innovations forward that are going to solve problems that are a priority. So how do you articulate that to the SMEs in the audience and others, and MNEs like ours, so that we know that what we're bringing forward is of value and is important?
Absolutely. So first of all, I agree on everything that was just said there as well. So how I see this is really working together and making sure we're creating value. So when I look at Covenant and how we determine where to start and where not to start within innovation, is really a little bit on looking at the opportunity on where government is looking and making it a priority, really support the greater vision and playing a larger role and working together and breaking down some of the barriers, because we must take in our part and help out and roll up our sleeve and work together. And if there's barriers, how do we sort them out together as well? And in terms of looking at the seniors opportunity, so we have a really, really strong strategic direction that we're following around stretching out our helping hand to those in need, especially looking at the footprint that we play within the continuing care and the seniors environment as a whole, and looking at the opportunities and the pains that we have gone through COVID, has been quite evident that this is kind of like, it's an imperative for us to take the first priority on. And this is kind of how we discern based on what's going on in the environment, what is government challenging us to do, and essentially developing that strong vision together with HS hand in hand and ensuring that what we do contributes value.
Thank you, Connie. We're coming to the end of this panel, and I know there are other questions, and I'm so sorry we're not going to get to everything. Chris, there were questions coming in around if medtech is your only area of focus or pharma. So even if quickly you can say that.
Everything. If you've got technology and health, then we will happily try and work with you.
Amazing. And of course, Mark, you know that people are like, you're in the pathway. We're still trying to navigate through it. So if they can follow up with your team and get some best practices on how to accelerate that work, I know that they will. On behalf of BioAlberta, thank you very much to all the panelists today. I hope that inspired a discussion about innovation. I hope it's clear now where the many mechanisms are for SMEs in Alberta, but nationally can tuck in, get the support they need, find the funding, find the coaching, and we can advance innovation in healthcare together to benefit all Canadians. So thank you very much, everybody.
Thanks, Jessica.
Back to you, Rob.
Thank you.
Thank you.
Bye.
Well, thank you very much to Jessica, Francois, Chris, Connie, and Mark for that great session. Again, it's probably a session we could run all day with the questions coming in, which we at BioAlberta will take as an opportunity to look at how we move this discussion forward and advance it, not only with the experts you heard from today, but with the broader ecosystem. So that's a wrap for today. That is a ton of information. It's been a great day, kicked off by the minister and ended on how we drive innovation into the system. Again, please forward your questions. We will get answers to them and post them so you have access to them. I want to give a teaser for tomorrow. As you know, we start again at 10 o'clock. Sharp with a presentation from Justin Reamer, the Assistant Deputy Minister from Western Diversification for Alberta and the Prairies. I will let you know that there was a short change in our schedule that wasn't enough of an opportunity to change speakers, but it was enough of an opportunity for Justin to record his presentation for us. And then we'll have the Q&A with Jason Pincock, the CEO of DynaLife. After that session, after that keynote, we will move into a session on building bioindustrial strategy for Alberta and what our role should be in developing that framework. A presentation by John Lewis at Entos, and finally, to end the day, a session on building Alberta's life science talent and culture, which, as you've heard throughout today, is an important anchor as we continue to build this sector. Once again, I just want to thank all of our panelists. I want to thank our participants as well. I want to thank our sponsors for the policy forum, Medtronic, MedTech Canada, Pfizer, Merck as a panel sponsor, 360 Public Affairs, Gilead, MedTech Plus, IMC, Innovative Medicines Canada, BioTalent Canada, and Novartis. With that, thank you very much for your participation today. Thank you again to everybody. It's been a great day. I look forward to doing it again tomorrow. Thank you very much.